Welcome back. It is now time for Ask the Expert. March is Multiple Sclerosis Awareness Month.
So joining us live this afternoon from Aurora Healthcare is Dr. Akram Dastagir to talk about some of the ways to identify and treat MS. So thank you very much for being here.
Oh, you're welcome. Thanks for having me.
How common is this?
Well, MS is actually a pretty rare disease, but we do encounter it in our practice. It's about 0.1% of the general population, but the numbers, if you want to know, is actually about 400,000 in the U.S. and about 2.5 million worldwide.
So what are the symptoms of MS?
There are many symptoms of MS. That can start with blurry vision, double vision, fatigue, sensory symptoms which can include numbness or tingling, or loss of sensation, weakness, difficulty walking, bowel bladder problems are one of the more common presentations of our MS patients. As
an advocate for your own health, though, when should you say to your doctor, should I be tested for MS? If some of those symptoms that you mentioned could be anything, you know?
Correct, yeah. Many times a lot of my patients get bounced around to different physicians. They go to a urologist or a kidney doctor because they're having bowel bladder problems, or they go to an ophthalmologist, an eye doctor because they're having blurry vision. So whenever you have any of these symptoms that I've mentioned, you'd probably mention to your doctor that you'd like to see a neurologist just to be sure to get it checked out.
You can see onset as early as your younger years, or is it later years?
Yeah, most commonly around age between 15 to 45, but I've actually seen patients who are 2 years old and even diagnosed someone who was 74 years old recently. So there's a huge age spectrum.
Is there a common way to treat it?
Unfortunately, there's no cure, but we have many medications right now. There's 15 approved medications that we can use to help prevent relapses or prevent progression. So it's very important that some people feel, oh, you know, I'll just get better, I'll just hang in there. That's not the right approach. You want to get out and reach out to your doctor because these medications can really help.
And it's fearful to get that diagnosis that you have MS, but it's not necessarily a death sentence.
That's correct, yeah. There's a slightly decreased lifespan, maybe by a few years, but usually people die from complications rather than from the disease. And I have many patients who are doing very well. They're CEOs of big companies and they're athletes. And so, you know, if you're treated well and you're taken care of well, you can do good.